Member from Bruce-Grey-Owen South.
Thank you very much, Mr. Speaker. My question is the Minister of Health and Long-Term Care. Back in December of 2016, the Minister received a proposal from the Ontario Personal Support Workers Association requesting the right to become the provincial governing body of PSWs. The Minister would know there are many more PSWs in the healthcare system today than ever before. This means there's a greater need and role of our hardworking PSWs to match the increased need for home and community care. It also means there's a big need for proper oversight by a governing body to oversee the needs of PSWs and their clients. Mr. Speaker, the Minister purports to be supportive of a healthcare system that protects all patients and healthcare providers. Therefore, can he tell this House when we can expect a response or action regarding this proposal?
Thank you. Minister of Health, Long-Term Care.
Well, thank you, Mr. Speaker, and I appreciate the opportunity to talk about the government investments in our personal support workers. And I have to say, I have the greatest respect for the thousands upon thousands of personal support workers who work so hard day and night, often on very short notice, Mr. Speaker. And when you talk to people who are receiving care from them, wherever that might be, it might be in a long-term care facility, it might be in their home, I think alongside nurses, the individual, the type of healthcare worker that is so most highly respected by individuals and the ones that they develop that strong, respectful, challenging at times relationship with are our PSWs. So we've made investments where we've dramatically increased the minimum wage that here in Ontario, now it's $16.50, Mr. Speaker, is the minimum. It reflects the talents that they bring, but we're doing much more with regards to our PSWs, and I'll talk about that in supplementary.
Supplementary.
Mr. Speaker, perhaps the Minister should look at the people in the audience that are here from the PSWs. They were shaking their head no. I remind the Minister that his government already failed just a year ago when they opened and closed a PSW registry, a failure that cost insurance over $5 million. With an increasing aging population and our healthcare services being rationed, it's imperative that he takes action and gets this right. The OPSWA's proposal is comprehensive and outlines the importance of safety, accountability, legitimacy, trust, and oversight, things you claim your government upholds. Mr. Speaker, the Minister's response acknowledges the important and expanding roles of our PSWs in our healthcare system. But will he now agree to give them their right to have a say on the future of their profession?
Thank you. Be seated, please. Be seated, please. Thank you. Minister.
Oh, thank you, Mr. Speaker. And we are continuing to work on the future of the PSW Registry. It is true that I made the decision to close the previous registry in 2016 because I had respect for the profession and I wanted to make sure the registry was a powerful tool for individuals, for PSWs to gain employment, for employers to find employees, and for individuals that rely on PSWs to get that support. So we're working hard on that. We've also created a curriculum, a standardized curriculum for PSWs. We've got a $10 million annual fund for training for PSWs who want to advance their training further, Mr. Speaker. We contributed an additional $100 million this year alone to enhance home care clients, the support to them, home care clients. That translates into 1.3 million more hours 1.3 million more hours of personal support care in home care. These are the kinds of investments that we're making to this important profession.
Thank you.